My team manage the applications, testing, training, also the integration between the systems and the transformation, how these systems are actually implemented. The last year has been a really busy, hectic time for all staff across the Trust. IT as a support function has adapted to operational and clinical requirements and changes very quickly. Healthcare delivery has completely changed from a more face-to-face approach to virtual consultations. And we've seen a massive increase in the use of technology for all our staff, and it's now probably second nature to hold a meeting virtually rather than a face-to-face meeting, which is a big change from 6-7 months ago. So the IT department are working very closely with the Quality First team to deliver future changes and transformation projects. Outpatient modernisation is one major area. Under the leadership of Jim McLeish and Monica Bowes, the way that the Trust provides outpatient consultation, as I said, has moved from face-to-face to virtual or telephone across all specialities. And ICT as a department, we've delivered hundreds of headsets, webcams, and over 500 laptops to allow staff to actually facilitate these meetings. We're using a platform called Attend Anywhere for this, which manages that interaction between the patient and the clinician. We've also worked closely with the patient experience team to deliver virtual visitor for our patients and their relatives. And we've also linked in with the community for advice and guidance virtual links. For example, the gastro consultants speaking to the GPs regarding patient queries. So the next year is going to be busy for outpatient modernisation as well. We'll continue with initiatives to improve how we communicate with our patients by text or for patient reminders, and also by email. And as part of the COVID response as well, we're going to be looking at a virtual check-in software. So patients, when they arrive on site, will be able to check in as arrived for their face-to-face appointments. So this will significantly improve patient care and their experience in the hospital.
I look after the service desk, desktop, infrastructure team and the business partners as well. I just want to give you a quick intro around what we've done this past year and things that are coming up in the pipeline as well. So as you know, it's been a very, very busy year. We've made a vast number of devices available to staff and enabled technology to accommodate new ways of working. Immediately after the COVID outbreak, we set up a tech bar for walk-in support. As mentioned, the changes to care provision required vast items of equipment to be specified, ordered and deployed to support the change in delivery modules and to enable working from home for our people. Major infrastructure projects have been completed, and IT have been working with estates and our operational colleagues in the setup of Cow Park, where multiple departments have been relocated, making sure that ICT provision is covered. A vast number of additional iPads and iPods have been deployed to ward areas to enable access to applications. And other initiatives have been deployed quickly this year, including 2,800 plus devices moving over to Windows 10, password self-service implementations, PACS and ICE on mobile devices, upgrades to our web browser to include Edgium to allow video within web browsers, remote working solutions for over 400 people to enable staff to work from home, especially those self-isolating. We've made changes to our switchboard and our phone system. You'll see many people have moved over to the new 8x8 system in Cow Park and some of the contact centres, and we'll be pushing that out further this year to the rest of the organisation. We've also put in place Microsoft Teams to enable virtual meetings, which has changed the way we communicate with our colleagues both internally and externally. Most meetings now being virtual using the technology that we've deployed, including webcams and headsets. We've also put together over 32 training guides and updated these and loaded those onto Alex, our intranet website, to support our users going forward. To improve relationships and to capture healthcare group requirements, business partners have been recruited within IT. So I'd like to introduce you to Paul and Tony, who cover what areas they're covering within the healthcare groups.
I am an ICT business partner supporting the executive team, corporate services, medicine and healthcare group and estates and facilities. My role is to converge the IT strategy and the business's strategy.
I'm the ICT business manager for cancer, cardiology and clinical support, family and women's, and surgery and critical care healthcare groups. I help bridge the gap between the ICT department and any plans that the local healthcare groups have in terms of IT and making new and more efficient ways of working.